Hello everyone. This is chapter 13 from the Healthy Living text, which is covering the topic of cancer. This is a scary topic, but I'm willing to guess we've probably all been impacted in one way or another by this disease or collection of diseases. As I mentioned, cancer sort of refers to many diseases. There are multiple different types of cancer. What all cancers have in common is that they are abnormal growth, division, and differentiation of cells. Cancer cells metastasize or spread to other parts of the body. They form masses called malignant tumors, and they don't stop growing and dividing at appropriate times. And that's the big problem with cancer. When they invade body tissues or organs, they can affect the function of those organs. Normal cells are programmed to stop growing at a certain point. Cancer cells lack that ability. So cancer cells will develop in cells with damaged genes or mutations, and these are largely believed to be due to environmental factors, including lifestyle. Mutations, they can also be inherited or caused by exposure to radiation, drugs, toxic chemicals, and even infection with certain viruses can cause some genetic mutations and allow cancer to form. Some terms that go along with cancer genes and development. Oncogenes are on switches that speed cell growth. Genetic mutations can produce oncogenes, which and then in turn produce more cancer cells. Tumor suppressor genes are off switches that slow cell growth. But again, if a cell is mutated, it will no longer suppress cell growth, and then cancer is allowed to grow. Successive genetic changes have to take place in order to turn a normal cell into a cancerous cell. It usually isn't something that just happens quickly. Benign tumors are surrounded by a fibrous capsule, so they don't spread as easily. They don't typically invade surrounding tissues, and they're easier to remove surgically if they need to be. There is a figure in your book, figure 13.1, that shows some pictures of cancer versus normal cells and what they look like. Cancer cells have the ability to spread or metastasize. Again, they travel typically through the blood or the lymph system to get to other parts of the body, and cells that metastasize are called malignant. So malignant cancers are usually the more dangerous forms of cancer. Once cancer has metastasized, it's harder to treat and harder to control. Again, cancer cells will enter the bloodstream or the lymphatic system. That's how they get to other parts of the body, and then they can attach on and form new tumors there as well. Cancers are named according to the type of tissue from which they develop or come from. Carcinomas arrive from epithelial tissue. Examples of these would be lung, mouth, stomach, skin, breast, colon, and ovarian cancers. Sarcomas arrive from connective or muscle tissue. Leukemias are cancer of the blood and related cells. Lymphomas are cancers of the lymphatic system. And cancers of the nervous system have a whole lot of different names. So those are usually your brain cancers. Figure 13.3 on page 427 in your book shows cancer death rates according to male versus female. And one thing to note on those charts is that there is an overall decline in the rate of cancer deaths here in the United States, which shows that we're getting a little bit better at preventing and treating certain types of cancers. So here's a diagram of how cancers develop and spread. Cancer cells don't bind as tightly together as normal cells do, so it's a little bit easier for them to break off and then get into the bloodstream or the lymph system and travel to different parts of the body. It only takes one cell, one cancer cell, to start another tumor. The American Cancer Society, you'll see ACS a couple times throughout this lecture, recommends screening for early detection, particularly for those people who may be considered high risk for cancer or if they have any symptoms. A visual examination may sometimes be enough. Sometimes self-examinations, we talk about breast self-examinations, skin exams to try to detect cancers early. Clinical or physician examinations, by going to see a doctor, they may order some laboratory testing, do a biopsy where they remove some tissue to determine if there are cancerous cells present, and different scans can be used, MRIs, CAT scans, mammography. Those are all used to help detect cancer. Staging is trying to describe the extent of growth and the metastasis of cancer. There's a TNM system of staging. T describes the original tumor, N is whether or not it's reached the lymph nodes, and M describes if it has been metastasized or if it has spread anywhere else. So this is established first, the TNM system, and then we use that to give cancer a stage 1 through 4. 1 is the least advanced, 4 is the most advanced type of cancer. So treatment for cancer, surgery is often used to remove the tumor and the surrounding tissues to make sure that they gut all of the tumor. So most cancer cures are accomplished through surgery. Surgery is not as effective if the cancer has spread to multiple areas. Radiation is also a fairly common treatment for cancer. It kills localized cancers. It can be used alone or in conjunction with surgery. There is a new treatment area in this, or a new treatment in this area of radiation called proton therapy, which is a little bit more focused than even radiation, and it's showing some promise in its early stages. Chemotherapy is also another common treatment for cancer. It inhibits cancer cell reproduction or destroys metastasized cancer cells. This is the type of treatment that's used most often if the cancer has spread. Chemotherapy is usually administered intravenously through an IV, and it delivers anti-cancer drugs. The way that most chemotherapy works is that they target those rapidly developing and rapidly growing cells. And so it does kill the cancer cells, but it also kills other rapid growing cells in the body, which are like our hair cells and things like that. And that's why a lot of people who have chemotherapy end up losing their hair. So there are some pretty serious side effects to chemotherapy. Looking at laser and photodynamic therapies, they are looking at laser therapy, which is high-intensity light that can be focused with a lot of precision. So looking at removing some superficial skin cancers, as well as some of those in interior body locations. Usually they use an endoscope with a laser attachment. There is a chemical called photosensitizer, which reacts with a special light. So you can take this drug, the photosensitizer is absorbed by the cancer cells, and then you can use the laser to kill the cancer cells. Tumor cells can be targets for treatment because they absorb that photosensitizer better than healthy cells. And then the body also starts to create an immune response to those cells. Some other targeted therapy, there are a lot of different drugs out there now that can be used to treat cancers. Some small molecule drugs do a very specific job to help sort of block cancer cells from growing and replicating. However, if the cancer would mutate, the drug may no longer be effective. Biomodulation is a term that refers to a biological response modification where we try to manipulate the immune system to help the body get rid of its cancer. Some examples of this would be gene therapy or the development of cancer vaccines, which is something that they are working on. The key to this is the working immune system and whether or not it has the ability to recognize the intruder as foreign so that it can mount an attack against those cells. Bone marrow or stem cell transplants are a treatment for especially leukemia type cancers, but patients get stem cell transplants in what looks like a blood donation or a blood transfusion. It can be used to resupply bone marrow if it's been destroyed by chemotherapy or radiation, or to give healthy stem cells to a person who has, again, leukemia, which is a cancer of the blood. Some of the risk factors for cancer, some are modifiable, some are not. The ones that we can't change are things like our heredity, what's passed down to us from our parents. Advanced age, older people tend to be a little bit more susceptible to more types of cancer. and sex. Some cancers affect women more, some cancers affect men more. Some of the risk factors that are modifiable include cigarette smoking, dietary patterns, physical activity, and weight management, which are all things that we've covered in previous chapters. So, cancers that are caused or related to tobacco use. We have quite a few slides about this, and we did a whole unit on smoking and tobacco. But lung cancer is the leading cause of all cancer deaths, so we have to bring it back and talk about it in the chapter a little bit as well. 30% of all cancer deaths and 87% of lung cancer deaths are due to tobacco. The signs and symptoms include a chronic cough, excess sputum or mucus, wheezing, chest pain, and lung infection. The diagnosis of lung cancer can be made with X-ray, MRI, and CT scans, looking at the cells in the sputum, and fiber optic examination of the bronchial passageway. So again, usually putting an endoscope down to take pictures of the lungs. Risk factors include the number of cigarettes smoked per day, the number of years a person smokes, how deeply he or she inhales, whether they're smoking high tar or unfiltered cigarettes, and all of those things. Again, the more cigarettes you smoke, the more years you smoke, those are all going to increase your risk of developing lung cancer. Quitting smoking does reduce the risk of developing lung cancer, and after 10 years of quitting, it'll be about half of that of a person who continued to smoke. It will never get back to the same level as someone who hasn't smoked, but it can significantly decrease. So it is important, no matter how long someone has smoked, if they can quit, it would be worth it. Risk factors and prevention. High consumption of alcoholic beverages and obesity also increase the incidence of lung cancer. Passive smoking is associated with a 20 to 30% increase in lung cancer risk. So remember that secondhand smoke. Asbestos particle inhalation, which is usually seen in like work environments, older buildings, and radon gas exposure. There is a picture in your book on page 439, figure 13.6, that shows the areas in the United States that have higher levels of radon, if you're interested in looking at that. Cancers of the larynx, oral cavity, and esophagus are also common in people who use tobacco. Also increases if they use or ingest a lot of alcohol or have HPV virus. Some of the signs and symptoms will include a hoarse voice, difficulty swallowing, and a sore throat. Those can all indicate larynx cancer. Recurrent heartburn may indicate esophageal cancer, and oral cancers are usually pretty easy to detect because they're visible. You can see them in the mouth, and they metastasize relatively quickly. Tobacco use can also cause cancers of the kidney and bladder. It comes in contact with the inhaled carcinogens after those substances enter the bloodstream. So as people smoke cigarettes, a lot of those chemicals that are found in cigarettes will circulate through the blood. Blood in the urine is a sign of kidney cancer or bladder cancer. Frequent, urgent, or difficult urination are also signs and symptoms of bladder cancer. And men who are over 50 who are heavy smokers have a higher risk of these cancers. Cancers of the pancreas. This is considered a silent cancer because the early symptoms, which include things like nausea, vomiting, weakness, and discomfort in the abdomen, are kind of vague. They're often undiagnosed or misdiagnosed at first. Obesity, a high-fat diet, physical inactivity, and diabetes are also other risk factors that will increase your chances of developing pancreatic cancer. And pancreatic cancer is pretty scary. Only about 6% of people who have pancreatic cancer survive beyond 5 years. So it's often, again, because it takes so long to diagnose that's what the problem is, that the cancer has usually grown and spread by that point. Acute myeloid leukemia affects the blood-producing cells in the bone marrow. So again, this is a leukemia. This is a cancer of the blood. Fewer white blood cells are produced, and white blood cells are infection-fighting cells. Exposure to benzene and ionizing radiation increase the risk of this leukemia, and benzene and substances that emit ionizing radiation are in cigarette smoke. So smokers are more likely to develop this type of leukemia as well. So cancer related to the diet. Poor diet, lack of physical activity, and obesity account for about 1/3 of cancer deaths in the United States. So here are some suggestions for dietary things that you can do to reduce your cancer risk. Stomach cancer is the one that's most strongly related to diet, but other cancers that can be affected by diet are colorectal cancer, breast cancer, and these are affected by heredity and other factors as well. So cancer of the stomach, incidence and death rate of stomach cancer has declined dramatically over the past 75 years. Sort of similar to pancreatic cancer, it can be hard to diagnose at first, so it's silent sort of in its early stages. The symptoms are usually attributed to just a stomach upset. Risk does increase with age, also with diets high in salt-cured, nitrate-cured, or smoked foods, consuming a lot of alcohol, and cigarette smoking all increase the risk of stomach cancers. Cancers of the colon and rectum. Colorectal cancer is the third most deadly cancer in the United States. The signs and symptoms depend on the location of the tumor, whether it's in the colon or the rectum. Abdominal pain, change in bowel habits, and blood in the stools are really important signs. Patients can be embarrassed to talk about this. Anyone other than like 5-year-old kids don't like to talk about poop, so it's hard to bring this up to the doctor. And so again, sometimes we can be late in diagnosing this type of cancer. So risk factors for colon and rectal cancers include advanced age, heredity, having a personal or family history of tumors in the area, physical inactivity and obesity, diets high in fat and or red meat, inadequate intake of fruits and vegetables, smoking, and more than one alcoholic drink per day. If it is detected early, surgery is usually the primary treatment, and it can be rather successful. Prevention is the best, so some things that can help with this are taking a low-dose aspirin, getting regular exercise, balanced diet with fruits, vegetables, and whole grains, less red meat, more fish, and eating less saturated fat. Some cancer related to hormone function. Breast cancer usually falls under this category. This is the second leading cause of cancer death for women in the United States, behind lung cancer. Over the past several years, the rates of death from breast cancer have been declining, again, due to prevention and early detection of cancers. So some risk factors include a family history. If a first-degree relative has breast cancer, that usually means there is an increased risk for someone developing cancer. About 5 to 10% of breast cancers are inherited. Having early menarche, or starting your period early, younger than age 12, or experiencing menopause late. Not bearing children, and a high-fat diet and obesity. Some signs and symptoms of breast cancer include changes in the breast tissue, tenderness of the nipple or discharge, and swelling or distortion of the breast. Breast cancer is uncommon in males, but it can occur. So some ways to detect breast cancer are doing monthly self-examinations, getting clinical breast exams, including mammography, yearly, especially after the age of 40. And treatments for breast cancer include lumpectomy, where they will remove the tumor itself, radiation therapy, mastectomy, which is removal of all of the breast tissue. A radical mastectomy is removal of the underlying tissue as well, chemotherapy, and hormonal therapy, including the drug tamoxifen. Endometrial cancer. Endometrium is the lining of the uterus, so this cancer is common in primarily postmenopausal women. The primary symptom is usually uterine bleeding, so after menopause, that's not a normal thing to have happen. Pap tests for cervical cancer don't reveal endometrial cancer, so an endometrial biopsy would be needed for a diagnosis. Treatment for this is usually a total hysterectomy, so surgical removal of the uterus. The primary risk factor for this is cumulative exposure to estrogen, so using oral contraceptives can help reduce the risk. And again, treatments include hysterectomy, radiation, hormones, and or chemotherapy. Cancer related to viral infection. Cervical cancer is the most prevalent virus-related cancer in the U.S. It is related to the HPV virus. Incidence has declined dramatically since 1960 due to Pap testing. Most women have no signs or symptoms when they are diagnosed with cervical cancer. It develops most often in women aged 20 through 40, and treatments can include surgery, radiation, laser treatment, and cryotherapy. Cryotherapy is like a freezing and removal of the cells. Cervical cancer, again, there is a strong link between HPV, the human... Oops, sorry about that. We went way too far. So there's a strong link between the human papillomavirus, and cervical cancer. HPV can cause genital warts. The risk of infection increases with the increased number of sexual partners or having different partners. And women who are sexually active before age 17 have a higher risk. There are treatments. The vaccine Gardasil was approved by the FDA in 2006, and that prevents infection with 4 different types of HPV. So the American Cancer Society recommends that all women have annual Pap tests starting at least 3 years after their first intercourse, but no later than age 21. If cervical cancer is detected early, it can be very treatable. And just to go back to the beginning, I kind of skipped over this, but long-term use of oral contraceptives, birth control pills, is associated with an increased risk of cervical cancer. So that is something to talk to your doctor about and sort of weigh your options. So again, as we mentioned earlier, the treatments for cervical cancer can include surgery, electrocoagulation, cryotherapy, and laser surgery. Depends on the age of the patient when they're diagnosed and their ability to bear children. All right, so cancer is related to ultraviolet radiation. There are 3 types of UV radiation, A, B, and C. They're all harmful, and they all have the potential to cause skin cancer. UVA is associated with sunburn, skin cancer, and premature aging. Artificial UV sources, so like tanning beds, may also generate UVC rays, and these are potent cancer-causing types of radiation. Tanning salons claim to be safer, that they only use certain types of UV radiation, but really they aren't. And really any type of tan or sunburn is a type of skin damage. So there are 3 main types of skin cancers. One is basal cell carcinoma. This is the most common cancer of the skin. About 60% of all skin cancers are basal cell carcinomas. They look like moles or pimples, can have pearl-like borders. They may crust, scale, and bleed. And the treatment for these, they're usually surgically removed and may also require cryotherapy as well. Squamous cell carcinomas are the second most common, especially for those that have fair skin. They appear flat, red, and scaling lesions. They may be slightly elevated. They can also develop in people with darker skin from chemical exposure, x-rays, burns, and chronic skin ulcers. Treatment for these is the same, usually surgical removal and cryotherapy if needed. Malignant melanoma is the most frequent cancer in women aged 25 to 29 and the second most frequent in women aged 30 to 34. It's also very common in white males. People with fair skin have a higher risk than those with dark skin, and those at highest risk are people with light blue eyes, very light hair, and skin that burns very easily. So here again, our best treatment is really prevention. Limit sun exposure, use sunscreen, wear protective clothing if you're going to be out in the sun for long periods, and avoid any artificial sources of UV light like tanning beds. Check your skin regularly for any lesions that are asymmetrical, have irregular borders, multiple colors, and have a diameter greater than a pencil eraser. And you can remember these as A, B, C, D. So asymmetrical, borders, colors, and diameter. All right, prostate cancer. It is the most prevalent cancer in men. It's the second most prevalent cause of cancer deaths in men, right behind lung cancer. Signs and symptoms, again, can begin nonspecific. but some that should be noted are uneven or reduced flow of urine, incomplete emptying of the bladder, urinating more frequently at night, and then pain in the pelvis, development of impotence and blood in the urine are all very serious signs and should be discussed with a physician. Risk factors are men who live in North America and Northwestern Europe are at a higher risk for developing prostate cancer. African Americans and Jamaicans of African descent have the highest prostate cancer incidence rate. Advanced age, typically the older we are, the more likely it is to happen. Heredity, obesity, and high-fat diet all increase your risk. Detection and treatment, an annual digital rectal exam and PSA blood test are recommended for all men over the age of 50. Prostate cancer is actually pretty slow growing. Most patients who have prostate cancer die of other causes. So treatment is usually just more watchful waiting. There are some researchers that say maybe more aggressive treatment should be done, but there was some statistics in your book, and 95% of men who have prostate cancer die with it, not of it. So they usually die of some other cause. Treatment can include removal of the prostate, but there are some serious side effects related to that, including impotence, incontinence, and other complications. So it's not always an easy choice. Testicular cancer, it's rare, it's highly curable. The signs and symptoms include painless swollen testes, a sensation of heaviness or aching in the testes, or a small lump on the testes. It usually strikes teenagers and young men between the age of 15 and 35. An increased risk factor would include failure for the testes to descend into the scrotal sac by age 6, and a self-exam every month after a warm bath or shower can be an easy way to self-detect if there's any lumps or potential signs of cancer. Ovarian cancer, again, there's no signs or symptoms in the early stage. As the disease progresses, women will often report frequency urination, bloating, pressure in the abdomen, vaginal bleeding in postmenopausal women, or irregular or heavy menses in premenopausal women. This does occur most commonly after menopause, so usually in older women. Some of the risk factors for ovarian cancer include advanced age. Again, 85 to 90% of these cancers develop in postmenopausal women. Early menarche or late menopause, not bearing children, living in a Western country, obesity, and again, the use of oral contraceptives can reduce the risk of this particular type of cancer. There is no accurate routine screening test for ovarian cancer. Pelvic examination, transvaginal ultrasound, and blood tests can detect some abnormalities, and then treatments typically include surgery, chemotherapy, and radiation. All right, so I know this has been a long one. To finish up here, reducing your risk for cancer. Again, prevention is going to be the best treatment for any of these types of cancer. So avoid smoking and exposure to secondhand smoke. Eat a well-balanced diet, low in fat and red meats, high in fruits and vegetables. Avoid eating cured or smoked meats. Exercise most days of the week. Maintain a healthy weight. If you're sexually active, use protection. Consider HPV vaccines. Use sunblock. Cover up in the sun. Don't use tanning beds. Women should talk to their healthcare providers about using oral contraceptives and hormone replacement therapy because while it may help prevent some cancers, it may increase the risk of others. Follow the American Cancer Society recommendations for cancer screening tests, including self-examinations, clinical exams, and doctor visits. In general, cancer risk increases with advancing age, so it's usually seen in older individuals. Although there are some cancers that are more common in younger adults, like melanoma, testicular cancer, cervical cancer, and breast cancer. Only about 1% of cancers occur in children, but cancer is the leading cause of death in children. So while it's not a lot of the cancers, it does cause a lot of death in children. All right, that's it. I know that was kind of a long one. Thanks for hanging in there with me. See you next time.